Welcome, everyone. My name is Dr. Jennifer Jennings with Rose Wellness. I'm very delighted to be spending the evening with you tonight, and I sincerely appreciate you all joining to hear a little bit about menopause and fertility within the integrative and functional medicine realm. So, I don't want to get too technical during this presentation, but I really want to hear if you have questions. So, if you have any questions, you're welcome to put them in the chat box. I will address those at the end. Just a friendly reminder that we cannot give medical advice. If you have a more detailed question, you can always reach out to Rose Wellness. So we're going to get started. So just a review of what we're going to cover this evening. We're going to give an intro into hormone health, menopause, and some functional fertility. We're going to talk a little bit about symptoms that one might experience within perimenopause and the menopausal period, how we go about the diagnosis, and also health benefits of treatment, all of the different treatment options for hormones, as well as fertility. We're going to talk about the role of ESR1 and 2, some long-term support and recovery. Again, we're going to dip into fertility treatments and how to manage infertility since we're seeing more and more of that clinically, some tried and true research-based supplements, and some prevention strategies. So what is the definition of menopause? A lot of us think that we're perimenopausal or we may be having symptoms of menopause, but we're really not quite sure exactly what it might be. But it's the natural biologic process of marking the end of a woman's reproductive years. And it's typically diagnosed after 12 consecutive months without a menstrual cycle. Now, this can be very frustrating for a lot of patients because they may go even 9, 10, 11 months. And then if they develop a menstruation, then they have to start that clock over again. So the consecutive part of losing your period is very important. There's also different blood tests that can be run to determine what stage you're in. And the significance of menopause is that it can affect physical health, emotional well-being, and quality of life. So many of you who may be struggling with perimenopause or even early stages of menopause know that it certainly can affect things such as sleep and the way we feel physically and our brain. But there's other physiologic effects that are very important to discuss that we will get to shortly. And impact on life, we know that it often can impair our daily activities. It can impair our work performance, our brain's ability to perform adequately and acutely. It can even affect social interactions if you're just feeling fatigue or brain fog or having insomnia. It certainly can affect personal relationships if there's some irritability, if there's mood changes. Again, insomnia can just make us feel pretty rotten the next day. And we know that managing these changes is key to having a healthy life. So let's talk a little bit about some of the common symptoms of menopause. And many of you may have experienced these in your lifetime. So hot flashes, a little bit different for women. Some report it as just this flushing that starts kind of from the base of their belly and works their way up to their face. You can see in the depiction to the right here that it's showing you all of the different symptoms that women might experience. Other women actually break out into a sweat. And so you'll see them kind of taking their sweaters on and off, a lot of sweating. It can be very, very disruptive to sleep and could cause quite a bit of insomnia. We typically talk quite a bit about sleep hygiene in a functional medicine realm. And so oftentimes my recommendations to patients is, to perhaps take an Epsom salt bath at night with magnesium flakes, to turn off all the lights in the bathroom and light some candles. Try to stay off of your devices. And if you have to be on your device, then use amber colored blue blockers. Be sure that what you're putting inside of your brain before bed is peaceful. So, not the crime TV that's going to have you anxious or having nightmares. I try not to open my email just before bed because it tends to just stir up a little bit of anxiety. Really try to bring yourself down, reading peaceful books, watching peaceful TV, or just resting. Women can also experience mood swings, fatigue, which we've talked about, where they just feel very tired and foggy. some memory challenges. So they might say, I just can't remember names anymore, or I'll tell my husband something and he tells me over and over again that he's already given me the answer, that I've already asked this. There may be some vaginal dryness, which can be managed in a lot of different ways, both supplement, over the counter, and also prescription. And they even may describe some bloating or a sensation of abdominal fullness or deposition of fat around the middle. I thought this was a very cute slide because it's very fitting for how women feel during menopause. The seven dwarves of menopause: itchy, bitchy, sleepy, bloated, forgetful. And so it's important to know that these are real symptoms. It's okay to share with your loved ones that you're going through some changes and that you're hoping for their understanding. Sharing articles with them, helping them to understand that this is a physiologic change. Just some milestones as far as the history, where we've been with menopause and HRT, and where we are now, which we will get to shortly. But back in the 30s, there was a discovery that pregnant mare's urine contained some steroid hormones, and that's how a lot of synthetic hormones were derived, is from horse urine. In 33, there was an introduction of a synthetic medication from women's urine as an HRT. In 42, Premarin became available. In 48, lower doses of Premarin became introduced. We know that sometimes too much progesterone is not good as well. In the 50s, there was a campaign through a laboratory that started educating doctors on menopause and treatment options. So it really wasn't even talked about much until that time. In the 60s, about 12% of postmenopausal women were using Premarin. By 64, there was a Newsweek publication which was titled "No More Menopause." And so that led to more of a surge in women looking for some help and assistance with pharmaceuticals to feel better. 66, a book was published called Feminine Forever. It promoted the idea that women could avoid menopausal symptoms through hormone replacement therapy. Imagine that. We don't have to feel like the seven dwarfs of menopause. And in the early 70s is where there started some critique over medicalization of menopause. And that's where some of the studies were critiqued. And we will get into some of that. So when we talk about transdermal HRT, what we know is that HRT showed a net positive impact on hemostatic and inflammatory factors. So again, it's changing physiology, not only just our symptoms, but things are really being improved beneath the skin. We also noted that it improved cardiovascular health markers, and that's so essential because cardiovascular disease is really the top for women, and oftentimes our symptoms are much different than men and therefore can be missed. We also found that it enhanced the quality of life, which is critical. So the research really supported compounded transdermal HRT as a beneficial therapeutic option for perimenopausal, postmenopausal women, contributing to improved health outcomes across several physiologic areas. And you can see I'm including a lot of peer-reviewed articles. These things are drawn from the literature. I won't get into the nitty-gritty scientific details because this presentation is not for medical providers. It is for prospective patients. But certainly, if you wanted a copy of the PowerPoint and you wanted to read through the articles, we are more than happy to share that with you. Sorry. So what we found was we went through historical, we went through this study, but we also found that vasomotor symptoms and cardiovascular disease, that this is a really big part of HRT. Frequent, persistent vasomotor symptoms are more than an annoyance. They're associated with increased cardiovascular events. That's really, really important. So these women that are having, the hot flashes and, perhaps some blood pressure changes and the like, we're finding that it's actually affecting cardiovascular risk down the road. There's more than that for HRT. So for women, it's not just I want to be on this because I don't want symptoms. It's really I want to be on this because I want to prevent future disease and maintain my health and be the healthiest version of myself. And so what we're finding through the studies is that it can help with bone health. So bone density, osteopenia, osteoporosis. We know that weight bearing activities are critical and resistance training as we get older. So, a real simple solution that I share with my patients is wearing a weighted vest, wearing ankle weights, wrist weights as you take a walk, finding hills. You know, if you're on a Peloton or you like to bike, crank up the resistance. If you're on ellipticals, you know, increase that incline and the resistance from time to time. You don't have to do it straight the entire time, but certainly give yourself a little bit of heart rate variability. We also find that it can assist with mood regulation. So, the mood swings, the emotional well being, those PMS type symptoms where you just feel irritable and you sense within yourself that you feel irritable. We also find that it helps with metabolic syndrome parameters. So, when we talk about metabolic syndrome, it's things like obesity and glucose management and, you know, cholesterol, blood pressure, all the things. It also can support our brain, memory and cognitive functions, very important as we age. Sleep quality. It's not just that insomnia is an annoyance. We know that measuring deep sleep, measuring REM sleep, quality of sleep, restfulness is all very important in terms of how we present the next day, mentally, performance, productivity, um, how we feel mood wise, but it also has implications for long term health. When they look at the studies of night shift workers that aren't getting good sleep or are getting broken sleep or short sleep, they have worse health outcomes. And also weight management. And again, study of night shift workers, sleep issues. We know that they can have increased issues with morbidity, mortality, but also weight. So this is sort of a complex slide that I won't get into the nitty-gritties about, but it's outlining the major hormones that affect women during this transition and after. And so this is just a slide that depicts our hormone cascade. Um, Oftentimes we'll measure pregnenolone levels on blood work because it is sort of our mother hormone, which can help with production of all the other hormones. Pregnenolone can produce progesterone. We also look at DHEA, which is part of the androgen cascade, and the two testosterones, which is DHT and testosterone, free and total. We also look at progesterones, of course, and we can't forget about our adrenals. We also may want to look at thyroid hormones as well. So there was a study on HRT and health outcomes in women. And what they found is that there was an improvement in hemostatic and inflammatory markers, which is very important. So oftentimes we're measuring CRP, ESR, homocysteine on patients. If you've ever had an issue with those levels and you're in menopause, this is something that should interest you. We find there's positive changes in cardiovascular biomarkers, and that again, there's enhanced quality of life measures. The hormones that we're most concerned about, we've talked about the estrogens, and there's several. There's some that are better than others, right? You want higher levels of the better and lower levels of the bad. You want to look at progesterone levels, two types of testosterone and DHEA. We talked about pregnenolone, cortisol, and thyroid if indicated. How do we test hormones? So many patients come in and they just want a flat blood test on their hormones and they want to move forward with treatment. But what I share with patients is that drawing a serum level at one point in time tells us how we look Tuesday at 2 o'clock. It does not tell us how we look day 1 through 15 through day 30. It doesn't show us how we look at 8 a.m. versus 12 versus 8 p.m. It doesn't show us how we look pre-ovulation, pre-menstruation, during menstruation, or post. And even if you're in menopause, there is still some fluctuation of hormones. So I typically run a saliva test. You can see that it has a very good rating. Other doctors might run saliva and urine if they're in the functional medicine realm, integrative realm. Many conventional docs just run a serum level, which has some limitations, but you can see how they all compare to each other on this chart, which I thought was very useful. So, what type of clinical pearls can we add in terms of lifestyle management? So, exercise, very important. I know that days where I feel foggy or tired or unmotivated, if I push myself to exercise, 98% of the time I feel great afterwards. And I say, gosh, I need to do this more often. So, exercise is good for us in a number of ways. It's great for our brain, our metabolism, our weight. It can help our mood. They've done studies with exercise and anxiety meds, antidepressants, and the like. Stress management, right? So being sure that you're in a healthy relationship, that the people that you are including in your life are givers and not takers. Being sure that you enjoy your profession and you're taking time for things like yoga or meditation or a walk in nature. And you're trying to balance your life as much as possible. Weight management, there's all sorts of ways to talk about healthy eating and exercise science and the science behind diets that have been studied, paleo, keto diets, Mediterranean diets, intermittent fasting, all of the things. Sleep hygiene, which we've already touched on. Counseling. It's a wonderful thing to do counseling. I go to therapy regularly because I want to maintain my mental health. And so there used to be a bit of a stigma on therapy and counseling, but really now it is just a wonderful thing to be able to share how you feel, to have a life coach, to have somebody who's in your corner so that you make sure that you're really aligned with your passions and things that bring you joy. Some dietary considerations. Again, you want to consider how much alcohol you're consuming over the course of a week. Sometimes patients get very comfortable with having 1 or 2 glasses of wine with dinner, but over the course of a week, that can add up. So I usually recommend to patients pick one night out of the week to have alcohol. If it's summertime and it has to be two, that's okay, but try to keep things in moderation. And not all alcohol is created equal. So we know that whiter alcohol is easier on the liver to detox. We know that some alcohol can be higher in sugar and preservatives. I usually recommend organic wine if you can find it. It's not very expensive. There's a company called Dry Farm Wines, which has really great biodynamic wines, very low chemicals in it. We can give you a link for that if you're interested. And if you're interested in other alcohol, I usually recommend a white alcohol with a seltzer and a citrus. Monitoring your caffeine intake. Again, caffeine can sort of stimulate blood pressure. It can stimulate more anxiety. I usually recommend 1 to 2 small cups per day. And if someone struggles with anxiety or panic, I usually try to omit it, but I do it slowly. Monitoring salt, especially if you feel puffy and you have blood pressure issues. White sugar is never really good. There's other sweet alternatives that are very healthy. Looking at your intake of carbohydrates that can transition into glucose, right? We want to look at things that lower glycemic index, especially if we're concerned about weight or blood sugar. Are there underlying food allergies in terms of gluten, dairy, nuts, soy, eggs? Those are typically the most common allergens. And then we want to increase our intake of healthy foods. So fruits, some of them will spike glycemic index. I typically recommend organic berries. Vegetables are great. You can eat more prebiotic-rich vegetables such as jicama, Jerusalem artichoke. Greener bananas are prebiotic-rich. Things like kimchi or fermented pickles, fermented sauerkraut. We know that fiber can help to balance hormones. We want to make sure that we're excreting appropriately, we're moving our bowels regularly, and that fiber can help to glue onto any of the bad hormones and move them out of your bowels. And then things like nuts and seeds and legumes, if you can tolerate those. So our goal is balance, right? Our goal is balance in life, from our mood to our physiology. And so, how do we balance hormones? We really want to start with assessing symptoms, getting a very, very detailed history on menstruation, what it's like, how it was in the past, how is it now. Usually we give a very detailed checklist about menopausal symptoms. Then we want to measure hormone levels. And it's not just the women's hormones, it's also the androgens. It can also be cortisol or thyroid. We really have to listen very, very intently and gather all of the right data to know what we want to assess, how we want to assess it. And then from that point, we come up with a treatment plan. And it may be way beyond just replacing female hormones, right? We might find additional things. We might find inflammation, or we might find metabolic syndrome, or we might find, um, that there's adrenal or thyroid issues in conjunction. We are all very intricate in our physiology. And typically within the functional medicine realm, we're ordering a lot of tests and we find a lot of things that we can optimize. And that's a wonderful thing, because then people start to really feel better. Some of the HRT options, I'm sure you've heard of many of them, the topicals, the vaginal, which can help with the vaginal dryness or atrophy. Some can be sublingual or oral. Oral is not super recommended just because of the liver involvement, and especially post-COVID and vaccine, we're finding that people may have thicker blood, and sometimes those oral estrogens can cause some issues with clotting. But there's also the opportunity for injections or even pellets. I'm not going to get into the nitty-gritty of the dosage guidelines, because that's really going to depend on a visit with your provider and your unique physiology and your unique results. But these are just some ideas of what a standard dosage might look like. And again, it's going to depend on your symptoms, your blood work, and the way you're responding to it. How do we monitor? Well, we test and we retest, and we reassess you. How are you feeling? How have things changed? Oftentimes I'll ask my patients, what percentage are you better? Maybe it's 95% better. That's awesome. We can't always get you to 100%, but we can certainly get you feeling pretty darn good. So we would, assess your hormone levels again. I do more than just yearly monitoring. I think people are changing quite a bit. I always remind my patients who are on prescriptions that, a lot of these medications are weight-based. So as we're gaining weight, we very well might need more. As we're losing weight, we very well might need less. And also our metabolism. As we get older, our metabolism changes. And as it slows down, we may need less medication. So I tend to be somebody who likes to keep a close eye on numbers so that you can be feeling like the best version of yourself every month. Some clinical pearls with hot flashes. I find this to be the most obtrusive part of menopause for most women. And it usually can indicate some estrogen issues. And if there's night sweats, there can be a sign of progesterone issues. And so usually we recommend women dress in layers. We don't recommend toxic deodorants. There's different ozone deodorants. There's deodorants without aluminum. Ideally, you do not want an antiperspirant, because when we're sweating, that is a primary way that we detox. So whether you need to, freshen up here and there, that's much better than wearing an antiperspirant. And if we find that the hormones are balanced, again, we will consider other things. We don't just meet with someone and say you have hormonal issues. That's all we're going to assess. We really take a detailed history from, how you were born, whether you were vaginal C-section, whether you were breast or bottle fed, your first year of life. And then we go through your pediatric years, adolescent years, and decade by decade. And we put this very intricate puzzle together and determine what additionally needs to be assessed. So oftentimes I'm looking at serotonin or dopamine levels. If there's mood issues, if someone's struggling with weight, I might look at more cardiovascular issues, especially if there's a strong family history. And then even looking at insulin resistance, leptin levels, inflammatory markers, all the things. So epigenetics and genomics has become sort of the, key word in functional medicine these days. And the reason why it's very helpful is because we can sort of map out what works for you as an organism. So I use the analogy, if you look at the DNA spiral and imagine that it's made out of Legos, we all have little Legos that are plucked out. Okay, it's just called errors in genetic metabolism. As we're all created as an initial organism, there are errors in that genetic makeup, and that's normal. For certain people, they can have, big errors where they end up with, birth defects and neurologic issues. But for most of us who end up without anything overt, we have minor little errors in that genetic metabolism. And now that we understand more about this, we can actually test for it. So we can test to see, how do you metabolize drugs? It's becoming very popular in psychiatry. You can actually determine what pharmaceutical is best for somebody. But the same is true with hormones. We can check to your estrogen receptor variants. We can look at CYP, which can influence how you convert testosterone to estrogen. This can have a lot to do with energy and libido. We look at cardiac risk, homocysteine levels, and also how you're going to metabolize these prescriptions if that's the way you choose to go. Now, it doesn't always mean you have to jump to prescriptions. I have a lot of patients that say, I want to do it with, diet, lifestyle, and supplements, and that's perfectly fine as well. We meet you where you're at, and we try to balance things as best as we can. And so, what's the importance of estrogen throughout the lifespan? We know that it regulates the menstrual cycle, reproductive functions, as we mentioned, bone health, can influence the urinary tract. It's not uncommon that women who are going through menopause are saying, gosh, I'm suddenly getting all these UTIs. Typically, that can be from the atrophy in the reproductive area. Having vaginal dryness not only is uncomfortable, but it also can have health implications. There is a reason why we have clearance of that area, and it has a robust microbiome. And so it actually can affect your health vaginally and through your urethra overall. We also know mood and serotonin can be compromised, hence why we look at sometimes serotonin and dopamine levels. We also know it can help with brain in a number of ways. It can help migration of neurons. That's pretty important as we age. And also it can act as an inflammation regulator. So we know that ESR1 and 2 are linked with estrogen dominant effects in younger women, such as fibroids, endometriosis, and this also can have an increased risk of cognitive decline and anxiety as we age. We also want to look at the impact of giving estrogen to postmenopausal women for cognition, as we mentioned. So again, HRT is affecting us in a number of ways, and our hormones are beneficial for more than one reason. It's important to look at bound and unbound estrogen receptors. This is why sometimes we'll measure sex hormone binding globulin, because it sort of acts as the boat that transports the hormones. So you may have a high level of hormones, but if your binding globulin is low, well, then you don't have enough of boats that are actually transporting it. We also know that cholesterol can have a big impact on hormones. It is the major transporter for our hormones. So individuals that perhaps are on statins and have cholesterol that's now too low may in fact have hormone compromise from that. So I'm not going to get into the nitty-gritties and all of the scientificness of this because of this audience. But basically, the premise of this slide is that when you look at these different receptors in estrogen dominance, cognitive function, we know that there's a greater risk of endometriosis with estrogen dominance, preeclampsia. We also know that there can be an increased risk of cognitive decline or even Alzheimer's. We talked about inflammatory markers. So it's not only CRP and ESR, which is oftentimes measured on blood work, but it's also NF-kappa B, interleukin 1, interleukin 6. So if you are someone who struggles with inflammation, has a lot of autoimmune issues, just feels stiff and feels like you're always inflamed, you may want to have some of these levels measured. You may want to have your hormone levels measured and consider therapy long term. ER2 modulates the function of ESR, which we talked about, which is another inflammatory marker. And ER2 will help suppress the anti-inflammatory or the inflammatory process. So how does estrogen affect aging? Many ways. We find that it inhibits transcription. We find that it's crucial in mitigating the negative effects of estrogen and as it relates to aging. So lots of talk right now in functional medicine about mitochondria. Mitochondria is the powerhouse of our cells. I usually use the example of a battery charger, right, that you have in your leaf blower. As the light gets dim, you have to plug it in. Our mitochondria are the same way. And unfortunately, we don't oftentimes give our body the alt control delete that we give our devices, right? When your iPhone starts acting up, you close out all the tabs, you power it down, you charge it, you give it an update. How often are we doing that with our human body? Not very much. We're usually running on empty, working too much, checking email, getting text 24/7. We live in a very sympathetic overdrive environment. And so that's why it's very important to add balance into your life and to make sure that you are adding in some parasympathetic activities such as yoga, meditation, calming books, dark room, Epsom salt baths, all of the things. The big concern is always cancer. Now, none of us have a crystal ball. None of us know if there's a cancer cell within us that perhaps is growing. What we do know is that we can gather data on family history. We can gather data on, the types of estrogens that are more harmful than others. We can gather data on your detox pathways and how they look, the strength of your liver. All of those things are very important. Um, but this is why regular surveillance is also very important with your primary or with your GYN. So when we talk about aromatase, it facilitates the conversion of androgens into various forms of estrogen. If you're ever interested in having your whole genetic panel studied, there's a lot of different genetic testing out there. If you look into Dr. Ben Lynch, he has some really great books. One is Dirty Genes, which will go through um, sort of snippets on what these genes mean and how it can pertain to you. I would recommend that you find a functional medicine provider who can recommend a very good test. 23andMe is a very basic one, but there are more comprehensive ones, and finding somebody who can really help you interpret it, more importantly, can help you translate it into health and wellness. So we know that the CYP gene, it leads to higher estrogen, which can be a concern. People that have significant migraines, it can increase your incidence of endometrial cancer. This is why it's very important to get a detailed menstrual history. And anytime there's any change in menstrual flow, that you get a workup for that with either a transvaginal sonogram looking at endometrial lining, are there polyps, are there fibroids? CYP is a critical enzyme in estrogen metabolism and detox. So we want to detox. There are a lot of foods out there that can help us detox. We can do far infrared saunas, we can exercise, we can do lymphatic drainage, we can do dry brushing. Hot Epsom salt baths are ways of detoxing. Charcoal tablets, making sure you're taking those away from supplements and prescriptions. But there's all sorts of ways to make sure that we're keeping our body like a running stream instead of a pond. We know that transdermal estriol can help with, cardiovascular outcomes. Super, super important in women as well as bone health and cognition. Another study which supports the prevention of Alzheimer's. So a lot of patients will come to me and say, my father had dementia or my mother's mother had Alzheimer's. I'm very concerned because I'm starting to get forgetful. Oftentimes we'll run the APOE gene to see if they have that genetic predisposition for it. Now, some patients will say, I'm afraid to know. I don't want to know, which is understandable. But what I typically encourage them with is that we can biohack. We can actually create some interventions with supplements and lifestyle and diet so that you reduce that risk. So there's a phrase that, genetics is the gun, but environment pulls the trigger. We could have a horrible genetic background, but if we make changes within our life and we're aware of the risk, then we can do something about it. Again, more support with Alzheimer's prevention. And now we're going to dip a little bit into infertility, which is the other end of the spectrum. What we know is that a lot of women are starting their families later. They are pursuing careers. They are, getting married a little bit later and might be starting their fertility journey in their 30s. And some of them may find that it's not as easy as they thought it would be to conceive. What are some of the significant factors when it comes to infertility? Body fat percentage, presence of PCOS. How is your microbiome, your gut health, your inflammation, food allergies? How's your endometrial tissue? Is it receptive to an egg and sperm and embryo? How's your diet? What kind of nutrients are you getting? We know that our food is quite devoid of nutrients, way more so than it was with our ancestors. Are there presence of infections, right? Going back to dysbiosis, even within the vaginal area. Is there any sort of an allergic response with the sperm? That really can be an issue as well. How is your egg quality? Wonderful book that's called It Starts with the Egg. I highly recommend it. It just goes through why we might have poor egg quality and what we can do about it. And oftentimes it takes a good 3 months to make that change. How are your pituitary hormones, your adrenals, your thyroid? Again, insulin, metabolic issues. How are your detox pathways? Your genetics, DNA methylation, your stress level. So many times women that are undergoing infertility treatments will say, oh, I'm just going to stop. I'm going to go on vacation with my husband because I just need a break. And what happens? They get pregnant. So stress has a lot to do with it. And sometimes we don't realize how much stress that we're under until we get away. Environmental toxins, it's a big one. So Europe has banned these horrible, horrible ingredients for about 20 years that the US still allows in their products. Beauty care industry is the leading cause of toxicity in women. Everything from hair dye, soaps, lotions, sunscreens, foundation. If you think about it, small little patches that we wear on our arm, whether it's estrogen or nitroglycerin, goes completely systemic. So when we're slathering things all over our face, all over our body, we're getting quite toxic. I typically recommend an app called Yuka, and you can barcode different beauty care products to see how they rate. A lot of these ingredients that the US still allows that are on our shelf, and oftentimes false advertising of all natural and organic, many of them are carcinogens, many of them are endocrine disruptors, and can be very toxic to the human body. More information about environmental toxins, and it's everywhere. We have pesticides in our food. Um, the quality of our drinking water is not the greatest. I typically recommend a Berkey water filter or distilled water with added trace minerals, ensuring that your coffee is organic so there's not a presence of mycotoxins, being sure that you know everything that's going on your body, in your body. There's a lot of things that we can't control out in our environment, but the things that we can control, we should be very mindful about. Supplements for fertility. And again, this is not a one size fits all. It really depends on who you are, what you're presenting with, how your blood work looks. The dosages will vary, but just a couple that have been highlighted in the research and have been studied: inositol, NAC, zinc. Zinc carnosine is a nice one if there's any gut issues. Selenium, CoQ10 can be very helpful for egg quality. Ubiquinol is the active version of CoQ10, and oftentimes you can even get injections of CoQ10. Vitex, acetyl L-carnitine. Want to make sure vitamin D levels are quite robust, 80 or 90. Folinic acid and alpha lipoic acid. And there's many others. Not all prenatals are created equal. Typically, I recommend a specific type of prenatal that really helps to support brain development. And you want to be on prenatals about 3 months. You really want to prepare for conception about 3 to 6 months prior to even starting. What else is out there in functional medicine for fertility? Oh my goodness, there are so many things. And the good news is a lot of fertility clinics are moving towards some integrative medicine or functional medicine in addition to the reproductive technology. They're using a lot of PRP now. So for those of you who are unaware, it is platelet-rich plasma. So they draw your blood, they spin it down in a centrifuge, they collect the platelets, and they can actually insert that into your vaginal area. There are even some docs that are using it for ovarian rejuvenation. It's like a outpatient mini surgical procedure. So that's kind of an exciting new development. There's some docs that are also using things such as human growth hormone, low dose naltrexone, all sorts of things that have shown to help with reducing inflammation and enhancing your conception rate. Ozone therapy has been studied as well. So if there's any providers near you that offer ozone therapy, it can be given intravaginally. They've done some studies as well on ozone saunas. So you get into a sauna and you're closed up and you get ozone therapy with carbonic acid, and that's been shown to help with ovarian rejuvenation, but also conception and reducing, the inflammation in that area. Growth hormone, we talked a little bit about. Growth hormone can be a peptide and it can be an injection. It can help with diminished ovarian reserve, help with ovarian stimulation. So that's pretty much just a really nice overview on perimenopause, menopause, HRT, and some ways that you could utilize functional medicine for fertility. So if there's anyone in your loved life, any of your family members or friends who are struggling, please share this with them. What I'm going to do is stop the recording and I'm going to open up the chat for questions. Again, we cannot give